Welcome back to this vodcast on caffeine. I'm joined by Dr. Astrid Nelig. Astrid, there's a common preconception that caffeine can increase blood pressure. Is there any evidence to support this?
Low doses of caffeine would induce a low increase of blood pressure, like having a conversation or taking stairs. Higher doses of caffeine would increase blood pressure a bit more, but in both cases it's short-term and not lasting long. It has also been shown that people drinking coffee containing caffeine are not at risk of developing hypertension.
What about other cardiovascular risk factors?
There is also evidence that caffeine doesn't affect other cardiovascular risk factors like cholesterol levels, for example, or homocysteine levels.
One of the commonest beliefs around drinking caffeinated coffee is that it can lead to dehydration. Can you shed some light on this?
Caffeine is a mild diuretic agent, but even if it increases the frequency of urination, it doesn't increase the amount of fluid passed. People get easily adapted to this situation, and it mostly affects non-consumers. However, the benefit that can come from the fluid intake from caffeinated beverages really outweighs the potential mild diuretic effect of caffeine.
So we don't need to stop drinking coffee?
No, and in fact the previous advice of stopping or moderating caffeinated drinks intake in order to maintain fluid balance is unfounded.
It's been suggested that women should lower their intake of caffeine in order to reduce their risk of osteoporosis. Can you shed some light on that?
Osteoporosis is a multifactorial disease. It is linked to a poor diet, to low calcium intake, to a sedentary lifestyle, and also to genetic factors. The reason why caffeine has a bad reputation is due to old animal studies that used very high unrealistic levels of caffeine, and these levels prevented ossification in rats. And since then, it's believed that caffeine is bad for osteoporosis.
What do we know, though, in humans now?
In 2013, two nice reviews appeared, but unfortunately they don't totally agree. One led to inconclusive data, and the other one showed a slight mineral bone loss, but no further risk of fracture. So we are still on the edge of needing more research on that topic.
But are there some groups of individuals who should be careful about their caffeine intake levels?
Yes, some people should be. We have seen it earlier with sleep. We have all different forms of genes in our brains, and which makes us more sensitive to caffeine's effect also, for example, on anxiety. So these people should limit their caffeine intake. And if they are unsure or have further symptoms, they should consult their physician.
And of course, there's some very specific advice for pregnancy, isn't there?
Yes, there are specific recommendations based on the fact that pregnant women metabolize caffeine more slowly than other women. So the advice for them is not to drink more than 200 to 300 milligrams of caffeine per day from all sources combined.
So finally, are there any recommendations around caffeine intake for the general population?
In Europe, there are no official guidelines for caffeine intake for the general population. Health Canada is the first group that set up levels and advised not to go over 400 milligrams per day, which is roughly 4 or 5 cups of coffee.
I would have thought it was quite feasible that quite a lot of people might go over that sort of level. What could they expect then?
For a certain category of people, they won't have any trouble because we are all different because of our genetic variability. But you might sometimes experience an overconsumption, and this overconsumption will have consequences on your sleep, and you get nervous and you get anxious. And this is also like eating too much. But if you go back to your usual intake, then everything is normalizing quite fast.
So what should our advice be to people about caffeine?
Based on the research that has been done, I would say that most people could continue enjoying their daily cups of coffee.
I'm glad to hear it. Thank you, Dr. Nalig, for this overview of the current research on caffeine. For more information on coffee and caffeine, visit www.coffeeandhealth.org.